Hello. Today I thought I would talk about what a typical day looks like as a nurse-patient advocate. This is probably the number one question that I receive is, Melissa, what do you do every day as a patient advocate? So my typical morning starts out with my list of things that I need to do that day. And the priority is always, what do my clients and their families need? And so typically that's physician appointments. So if I have a physician appointment that I'm going to be attending, whether that's in person or on the phone, I make sure that day, the morning of the appointment, that the appointment is still scheduled. That might entail calling the provider's office, just making sure there have been no changes in the provider's schedule. Also contacting my client, making sure they're going to go to their appointment. And also if there's any transportation that needs to be set up, that transportation will be picking up my client on time and getting them to their appointment on time. Prior to this, though, I have already prepared a medication, an up-to-date medication list. I've prepared questions for the provider, concerns for the provider, and very pertinent information that provider I know needs for that appointment. And so whether if I'm attending, I will bring that information with me. If it's information that I'm not going to be attending, but I'm going to be on the phone, that I make sure my client has with them to give to the provider. And sometimes I will send it prior to the appointment, especially if it's something like a specialist, right, that may want time to review a medical history, review the medications prior to walking into the room. So from my years of experience of being a nurse, we know that some providers, say a neurologist, they really like to know ahead of time before they're walking into the room, sort of what they're going to be faced with that patient. So my day usually makes sure that any appointments that are scheduled, just verifying that they're going to happen and that we are fully prepared for those appointments. Some other things that are priority may be follow-up from previous days for clients. Let's just say they had blood work done or they went for a CT scan. Just making sure that those results were sent to the providers, so the providers have them. Because sometimes what happens is that CT scan may be ordered by one provider, but we know that there are several other providers who would also want that information. So that's sort of typical of like the morning. And then the day starts with like your schedule. So if that appointment is, let's say, at 11 a.m., prior to that, you may be returning phone calls from other potential clients. So you may receive a phone call from, let's say, a daughter, right, who recognizes that she needs more support with caring for her mother. And that support looks like making sure that she's doing everything she can to help her mom as she is aging. So that phone call, if it's somebody who's just looking for, information about what does a nurse patient advocate do, it might be spending 30 minutes on a call with that daughter to just listen and say, okay, tell me more about your concerns. What about your mother's concerns? And how can I help you and what they're looking for? And at the same time, I share about what services I can provide. So a lot of times when people are coming for services, they're really just looking for peace of mind. They want to make sure that they are doing everything possible to help their loved one. So if it is a fit and you're like, yes, this is something I can help you with, I can meet with you and your mom and whoever else is involved in helping, and we can talk further. And this is usually an initial consultation where you are getting paid for the time to meet with them, to gather a health history, to gather a thorough and accurate medication list, and to truly just listen to, okay, this is what's going on. And here, as a nurse advocate, these are the ways that I think I can help you. So a lot of times it comes down to communication, right? There is some kind of communication that needs to happen between family members and clients and their providers, and amongst even providers themselves. So that is something that we as nurse patient advocates, we can definitely help with, right? We can make sure that our clients and their family members, their support team, understand what is even really going on, right? And sometimes that takes time to educate, along with then helping them find resources to what they're going through. And that may take a little bit more time. So as mentioned previously, maybe transportation to appointments has always been an issue, right? The daughter may be able to be on the phone for the appointment, but she doesn't know how to get mom to the appointment physically, and also like to encourage mom, like, mom, you really need to go to this appointment so we can get more information on what's truly going on with you. So that is a big part of it, is how can you help with the communication, the education, and the resources. And sometimes the resources, you're listening and you're like, you know what, transportation's an issue. Sometimes it may be that they need resources on assistance in the home. And so that might entail you getting to know providers in your community that can help serve your clients. So some days we're meeting with people, whether it's virtually through Zoom, if it's meeting for coffee, so you can better understand the services that they provide that might help your clients. So some of the people who support our clients are home care, home health, palliative and hospice, outpatient therapies, providers themselves, mental health providers who serve our community to better understand what information they need to help your clients. It could be senior centers. So looking for those services that support your clients and getting to know them. So in the event that your client does need those services, you have somebody that you trust, you have vetted, that you know will truly help your clients. So your day may consist of going to a provider appointment, again, virtually, just on the phone listening in, or in person. It might entail meeting with a client and a family and listening to them and creating a plan. It might be follow-up. You will have established clients that you meet with on a regular basis where you're checking in with them. And again, that could be simple as a phone call, just making sure, okay, how's everything going? Have there been any changes, any concerns? Or it could be visiting them in the home and making sure that, everything's okay at home. That's the nice thing about this, is that it is a very flexible schedule, and it's also, you're serving your client. So you be flexible on what's going on with them and how is it best to text them, call them, meet with them in person. A lot of the things we do is just making sure that nothing is sort of falling through the cracks, right? So sometimes you're just on the phone, making sure, like I said, that the blood work, got to the right provider, that maybe you're doing some research for a client that is looking for clinical trials, which is a little bit more complicated, right? Or looking for a new neurologist because their neurologist retired and they're not sure who to go to. So it's really customized for what we're doing. And so that's sort of a typical day of a nurse patient advocate, is you're prioritizing your clients and their needs, along with networking on with providers who serve your clients. And honestly, it's the best thing, because another question I might as well address while we're on, and it's already been so much time, is, well, how do clinicians, feel about when a nurse advocate is on the case? They love us. Why? As I mentioned, we prepare our clients and families prior to meeting with them and even after they meet with them, right? Because we know that we don't go to appointments prepared, right? We don't, and as a nurse advocate, we prepare them that they have all of their medications, they have all their thoughts and concerns written down, and we focus it towards the provider that they're seeing, right? So a cardiologist, that is going to look a lot different than seeing the podiatrist, right? And we prepare our clients so they are focused on seeing the cardiologist that day and not, providing them information they really don't need. And then vice versa, after that appointment, whatever the cardiologist orders, we make sure that our client gets to those appointments, gets the blood work done, and the cardiologist gets that, or, the monitoring gets to the follow-up appointment to get the monitor put on. So it's all that collaboration. And so those providers appreciate that their clients are coming prepared, that they're following up and getting what they, ordered done. So a lot of times they encourage us to be involved. They encourage our clients to involve us in the care. So it ends up just being this amazing kind of experience for all of us, right? One, our client, that's like the most important person. And also for the provider, like they're elevated. They're now, thank you. I needed this information. This is what I needed to help. And then for us as nurses and as advocates, it's sort of what we were always meant to do, right? We are advocates. We're all advocates. This just looks a little different because now we're, privately paid by our clients, and we're professional nurse advocates. So thank you for taking the time to watch this. I hope you have a little bit more insight onto what a typical day looks like for a nurse patient advocate. Please feel free to reach out to me anytime. My email is melissa@bridgehealthadvocates.com. Feel free to email me or go to our website, bridgehealthadvocates.com. Thanks.